So anal glands really are probably the most poorly designed bit of anatomy on a dog. They originally are used to scent mark territory, so for wild dogs. In the case of companion animal dogs, what happens is the anal glands, they kind of build and build and build, and when they get to a certain size, they actually block their own duct off. And she is an example of a dog that's really suffered with anal glands.
Yeah. She's only 2.5 and it's already happened so many times, and the vets explained it is likely to keep on happening, so actually we'd just like to get it solved once and for all.
That's a lot of pain to endure over the course of just a short 2-year lifespan.
Oh, she's such a chilled little dog. She's so lovely, so good-tempered, so tolerant with James and everything else, and with this as well. She's brilliant, so yeah. Mai is so sweet-natured to James. You want to sit next to Mai? One of the few words that he knows is Mai. The two of them growing up together is really, really sweet. They're really, really lovely together. Lucky boy. I could not imagine not having her now. She is just always so happy to see you. She's just been an absolutely perfect addition to the family.
Yes, I can see a bit of scarring on the left-hand side, which is the most recent rupture site. I think we, and that's including you, have battled valiantly to try and manage this without going down the surgical route.
Yeah.
But unfortunately, I think enough's enough.
Scott believes the solution is to surgically remove Mai's anal glands.
The rupturing does make my job more difficult because rather than having these pristine glands that you can see and you can inflate and you can remove, I'm going to have a lot of scar tissue.
Yeah.
And there are significant complications that come with performing surgery so close to the anus.
Yeah.
Worst case scenario, you can have an incontinent dog.
Yeah.
You can tell that Tracy's really nervous about today. Mai is kind of her first baby, the fur baby, and with James as well, clearly having a strong bond with the dog. It is a pretty big decision for Tracy to make. Do you want to give her a little bit of a kiss to say goodbye?
You be a good girl, yeah? Good girl, sweetie. You can be fine. Oh, bless her.
Come on then, here we go.
I know there can be a few side effects and a few things that can go wrong, so that makes it particularly nerve-wracking. We really hope it is worth the risk to get this operation done.
See you later.
Fab, thanks very much. Good luck.
All right, speak to you later. Thank
See you later,
you.
Mai.
Bye. I know. I know. It's okay. Yeah.
Hello.
So this is Mai. She has had so many problems with her bum.
In London, Scott's about to operate on Mai to remove her anal glands that have caused the 2-year-old massive problems her whole life.
She's off and on been at this vet practice since she was a puppy. So today I'm going to be performing bilateral anal gland removal or anal sacculectomy and hope that she's continent afterwards.
Of course. Fingers crossed.
Fingers crossed, exactly, yeah. She's such a lovely girl. There is a risk with this surgery because there's a huge amount of nerves around the anus. If you cut through them, sometimes the dog can become incontinent. Today is just about performing the surgery to the best of our ability. Hopefully she'll go home, no more anal gland problems, but still can control her bowels.
Sphincters. Okay.
You okay, beautiful? A little bit sad at the moment.
Very sleepy.
Sleepy.
The surgery isn't the most glamorous, but Scott and Nurse Judith are besotted with all their 4-legged patients.
So I was that kid that used to just hug every dog that went walking past. Ran across to the next door neighbours, hugged their dog. We'd go over friends' houses, I'd sit outside and hug the dog.
I just grew up with dogs all my life.
So your dog was like your best friend at that age?
My parents asked me, you want brothers or sisters? I said, no, I have my dog. I don't want a brother.
Tracy, they only came in today with James, her little toddler, who
the baby.
was chatting away about his Mai. So hopefully he'll keep napping whilst you have your nap for your surgery and then you can be reunited.
Yes.
But as Scott puts Mai under anaesthetic,
like those happy drugs, didn't you?
the little dog is in trouble.
Poor little Mai is not breathing. Just give him a little breath for me. With any dog going under an anaesthetic, there's risks of shock, sudden death. Come on, Mai, sleeping. So we do need to perform a few techniques, stimulate her, rub her, and get her through this to start breathing.
The sweet-natured 2-year-old is suddenly fighting for her life.
Just give him a little breath for me. giving Mai her induction anesthetic, she just takes a little bit longer than we would like for her to start breathing. Now, a lot of dogs do react to that induction agent like that, but hers was just longer than is comfortable. Oh, is there a little breath there?
Superficial.
She only had 2/3 of the dose as well. Okay. It's all right.
Now.
She's keeping me on my toes, isn't she?
Yeah.
This job, hey, gives you more grey hairs every day. I don't think that after 25 years of being a vet, I really need to be kept on my toes, but now Mai's breathing, hopefully the safe removal of her anal glands means that this dog won't have to keep going through all of this discomfort, all of these antibiotics needed to try and combat this condition. Okay, so that one's actually pretty intact. This one is a real mess. Now Mai's under anaesthetic, I get a chance to have a little feel of her anal glands. The right-hand side is fairly normal. It's full of a little bit of the discharge there, but fairly standard. The left-hand side, however, is very abnormal. It's very scarred, it's a bit lumpy, and as a result, that one is going to be a far harder challenge to remove. That one's going to be tricky. So what I'm doing here is I'm going to place this polymer into the anal glands. What it does is it kind of makes them very clear, so I can feel they'll be quite enlarged, and then this solidifies, and it's kind of like removing 2 olives. My nice green polymer is all solidified. Now I have to remove the glands. So for the next hour or so, I will be focusing on possibly Mai's least most attractive feature. You are cutting in an area that's full of nerves. So you just have to be careful and take your time, breathe, focus, and just know what a nerve looks like and know not to cut it. The surgery itself is just really tricky. It's difficult to probably see in there. All the tissues are about the same color, so there's a lot of pressure on this. Ella, can you get that light in there to shine through the window and into my butthole, please? It's not mine, personal butthole. That one. Oh. That's it, and then you know where you're shooting for. Going. Yes. Beautiful. Thank you. It's just really, really challenging as a surgery to make sure you're removing the right thing and you're not cutting the wrong thing. So you're trying to make the smallest incision and sort of be like a thief in the night and get it out. Okay, so that's one. The first gland does come out pretty easily, but the second gland is more challenging. It's far more attached to a number of tissues around the outside. There's quite a bit of bleeding. So I'm just recatheterizing the anal gland just to basically get my bearings, see where it wants to come out. Performing this surgery, I realized why I don't like doing this surgery, because you're constantly focused on a dog's bum, which is not very pleasant. But also the surgery itself is just really tricky. If you cut through the nerves around the anus, poor little Mai can become incontinent. Yeah, it's a real mess under here. The gland is just really damaged, so it's likely going to be more of a piecemeal removal of the remnants of the gland.
After an hour of painstaking and high-risk surgery, Scott finally has removed both of Mai's troublesome anal glands.
It's not the most pleasant of processes, but with patience, a lot of deep breathing and some muttered swear words, I think I've got there. There we go.
Well done.
Well done.
Beautiful.
So the surgery itself is a success in that the anal glands are gone. So we shouldn't have any issues at all with anal glands as a result. It's just whether there's been any damage to the nerves present around the anus leading to fecal incontinence, and the proof will be in the pudding. So we'll just hope that she's able to control her poos. So the moment of truth, I'm just going to check the anal tone just to see if her anus puckers, to just sort of show me that she still has sphincter control. It's hugely puckering at me at the moment.
But the initial anal tone test is not promising.
She's still a bit sleepy, so we'll try again later when she's woken up more effectively. Hi, baby. Okay, hopefully that's the last time I have to focus so much back there. Definitely not the nicer end. Oh, yeah, you good girl. Okay. Sorry, honey. I promised you I wouldn't be messing with your bum anymore.
In London, Scott is doing another test with Mai, hoping surgery to remove her anal glands hasn't left the young spaniel incontinent.
Oh, baby. I know. Yeah, it's good you can feel it. Yeah. Okay. Now I know that she hopefully won't soil herself. She can have her tail back. Good girl. Here we go, brave girl. You're so beautiful, aren't you? Oh, I'm so glad now I can focus on your beautiful face. Hey?
Relieved Mai's back end appears to be working normally,
Good girl, good girl.
it's time to reunite the 2-year-old with her loving owner Tracy.
It's felt like a long afternoon, to be quite honest, just desperate to see her now. James will definitely be happy to see her when he gets home. She'll run in the door, she'll be all excited to see him. My.
Okay, you ready? Let's go see Mummy. Come on, then. Good girl. Hi. Say hi, Mummy. Hi. Guess what I don't have anymore?
Yeah.
Anal glands. Yay!
Oh, sweetie.
You're very happy, aren't you? My gosh. Yes. So I'm really excited to reunite Mai with Tracy. They obviously have a really close relationship, and hopefully she'll start toileting normally very quickly, and that's the end of her anal gland problems. Well, she's done very well. I've actually just checked her anal tone. There's a little bit of movement already, so that's
Okay,
really
good.
good.
Yep.
So I feel confident that we're going to be good, and obviously we'll be able to develop a relationship that doesn't require me to mess with her bum.
Yes,
Which will be
please.
fantastic.
Yes.
Are you keen to get out of here? Yeah.
Thank you. Definitely a relief. I mean, I'm so glad it worked out. Really, really happy.
All right, see
Thank
you
you
later.
so much. Cheers.
All right, bye. Good puppy. See you later. Ah,
Thank
she's
you.
free. Free from the butt doctor.